Jess Gottlieb, born and raised in Indianapolis. I moved to Minneapolis in 2010. I told everyone I was just going to finish my MBA and move back to Ohio, and I met my husband, and here we are. My heart story really started when I was 29 weeks pregnant. Long story short, I ended up getting diagnosed with an infection, and they told me at the time, we'll do an echo just in case. I'm sure everything will be fine. And it wasn't. I had a congenital heart condition that I never knew about. I had a bicuspid valve. That afternoon, my blood work came back and I was in heart failure.
I was called to see her in ICU. She developed severe aortic insufficiency, which is basically very bad leak on aortic valve. She needed surgery. In simple way to explain why is that the leak on the valve when the infection happens, it happens suddenly.
I never thought that I would have a heart issue. I was a runner, I was an athlete my whole life, but I needed to have open heart surgery emergently that night.
She didn't feel well, but she didn't feel like she was dying, which we knew that actually could happen within hours.
This baby was going to have to be delivered that night in the cardiac OR.
As anybody can imagine, probably a cardio pregnancy program where you have a pregnant patient with cardiovascular disease obviously will include obstetrician, a gynecologist, cardiologist, and cardiac surgeon is part of this team. You have to have good collaboration between very often different divisions, different departments. The work plan that we created was proceeding with emergent cesarean section in the cardiovascular room where we can gather all teams together.
They all came in, they're sitting at the end of my bed, and Dr. Wagner kept saying the baby is the passenger on the ship, and you're the ship, and the ship is going down, and we need to take this passenger out, and we need to fix you up. It ended up being an 8.5-hour surgery. They ended up having to replace 6 inches of my aorta, the aortic root. They put a ring around my mitral valve to repair damage from the infection. I knew I had an incredible team around me. It was very obvious very early on.
This is a very good example of trying a new approach with the armamentarium that we have.
I can go back and live a normal, healthy life. I have a beautiful baby boy. I have my heart back together. I think I'm in better shape now than I was beforehand. I'm most thankful for Dr. Moody for being on call that night, for taking the case, knowing exactly what needed to happen and talking me into getting it done and why it was so important. For Dr. Wagner for delivering Jack, for the research that has made this possible, for the fact that there is a cardio pregnancy program here, that it happens to be in my backyard, that there's actual research. It's amazing. It's something that can't be taken for granted.